President Trump's doctor says that he can get back on the campaign trail. That is despite current isolation recommendations from the CDC for patients recovering from COVID-19. The surprise announcement that the president will be able to, quote, return to public engagements on Saturday comes just 1 week after it was first reported that he had the virus. Well, yesterday, President Trump spoke to Fox News' Sean Hannity about his condition. Just listen to this.
Have you had a test since your diagnosis a week ago?
Well, what we're doing is probably the test will be tomorrow, the actual test, because there's no reason to test all the time.
I think I'm better. When to a point where I'd love to do a rally tonight.
So the CDC recommends 2 negative tests before leaving isolation. That's after, of course, being isolated for a couple of weeks. So for more on this, we're joined by Dr. Bob Lahita. And we want to note Dr. Lahita cannot speak specifically about the president's case, of course, doctor, because you're not his doctor, but he can give us a professional medical opinion on how patients typically respond after recovering from COVID. You know, and what we also sort of didn't hear in that portion of the interview is at times the president had to stop and clear his throat. He sounded a little hoarse. So we just heard the president say that if it were up to him, he would hold a rally this weekend. From a medical standpoint, do you think that this is safe behavior, especially since it is less time than the recommended 14 days where he's supposed to be in isolation?
Anne-Marie, definitely not. If he were my patient, he would be quarantined. I would test him before he even went out of his house. In this case, it's the White House, and he's talking about getting in front of thousands and thousands of people and making a speech without a mask. And this is an extraordinary display of behavior that's very unusual. Now, I would caution you that the president has taken many, many drugs. Among he just finished remdesivir, but he's taken dexamethasone, and I can't stress enough that dexamethasone is a very powerful steroid which has exhilarating effects, euphoric effects on the body, gives you a sense of energy, causes insomnia, increases your appetite. All of those things I am sure the president is experiencing. So maybe this burst of energy, this feeling that he can go out and just do anything he wants to do is not a good idea medically. And I would definitely test him over and over again, and I wouldn't put him in front of a crowd, and I'd keep him quarantined in the White House. In fact, I would keep him isolated in his room, resting, because he can relapse at any time. We've seen patients go for 5, 6 days and then all of a sudden become short of breath again, and their pulse oxygenation drops, and they're back in the hospital. So this is a big issue, Anne-Marie.
Dr. Bob, we showed video there of the president when he made his way back to the White House. On his balcony there, you could see that he was short of breath, breathing heavily. Anne-Marie pointed to the tape that we didn't hear of the president during his interviews yesterday, sort of coughing and wheezing through some of them. I wonder, with the cocktail that the president is taking, you indicated what the effects may be on his sort of physical appearance and his demeanor. But I'm curious as to what's going on in the body, because we don't know from his doctors what's going on with his lungs as he's battling this virus. What's going on? You know, I guess the question I'm asking is, the drugs can give you the appearance of being healthy, but what we don't know is what is actually happening within his body that will continue to create long-term effects, and what would happen if he stops taking those cocktails.
Well, he's finished the remdesivir. That was a 5-day course. He has been getting dexamethasone, which is a steroid that suppresses the immune system. It's like turning down the lights in a dining room, you know, with a rheostat. His immune system has been tamped down. So that prevents the immune system from attacking the lung tissue. However, we don't know how much damage has been done to his lung, because I don't have access to his CT scan of his lung or his X-rays. And this is a problem because they have not exposed us to that. We have no evidence that there is lung involvement. But I would predict, based on what we see in thousands of other people, that there is lung involvement. And I'm sure he has his pulse oxygenation done every so many hours by the White House medical staff. So I think he's being monitored fairly closely. What I don't understand is how they can allow him to go out and do a public rally or several public rallies, because I would be exhausted if I were he and my pulse ox was dropping and going up and going down. It's just not a good medically savvy way to treat a patient who's recovering from an acute infection, Vlad.
Yeah, maybe that speaks to the impact of the steroids in terms of his ability or his energy level or his thinking that he has the energy to go through with something like this.
Yes.
We want to turn away from the president though, and talk about the real people out there and the risks that they face. Flu season is here, and I think there's a real concern about how do you identify whether or not you've got the flu or you have COVID-19. The other day I started to sort of feel sniffly, and immediately I panicked about, is it COVID? And then I had to remind myself, no, this is the time of year you normally get allergies. This is perfectly normal. So can you sort of give us some clues? How would you know if you felt like you were feeling under the weather? How would you know whether or not you were coming down with something like the flu or COVID?
Well, Anne Marie, you hit the nail right on the head. First of all, I would ask everybody watching to get an influenza shot, a vaccine shot. I know a lot of people don't like vaccines, but if you ever were going to get a flu shot, this is the year to get it. We have to, all of us, get it in the hospital. The second thing is it's very difficult, as an emergency room doctor, and I'm not an emergency room doctor, but as a doctor who has done emergency medicine, I would say it's tough to tell the difference between the flu and COVID-19. Now, the good news is we have quick tests for the flu, and I'm told that we're developing or going to get soon point-of-care tests for COVID-19, which means we'll be able to tell whether you have it in the emergency room within 15 minutes. The flu, we can tell. So if you go to the hospital, you can find out whether you have the flu versus COVID-19. But look at the symptoms. They're very similar. Cough, fever, aches and pains all over the body, feeling like you got hit by a bus. COVID-19 is 10 times worse than the flu. So, and I would agree with you, Anne Marie, all of us that get sore throats because of allergies, we're all going, oh, and including myself, I go, oh, my goodness, let me take my temperature and see if I have a temperature. And I'm worried always about contracting COVID-19, less so about the flu because I've already been immunized. That I tell all of your viewers to do, Anne Marie.
All right, Dr. Bob Lahita, as always, we thank you. Have
Thanks,
a nice
Vlad.
weekend.